Discriminating Between Warm Diseases, authored by the Qing Dynasty physician Wu Tang. Chapter 3, Middle Jiao section, sections 11 to 13. Yangming Warm Disease, specifically referring to a warm disease affecting the large intestine meridian. When presenting with upper Jiao symptoms and several days of no bowel movements, the following treatment measures should be taken. If the patient shows clear signs of yin deficiency, it is not advisable to use purgative medications. Instead, the use of yin-enhancing decoction is recommended for treatment. After administering yin-enhancing decoction, observe the patient's condition. If several days pass without a bowel movement, it is reasonable to consider supplementing with stomach-regulating purgative decoction for a milder treatment effect. This method replaces the treatment approach of Wu Yu's purgation and nourishing decoction. The brilliance of this therapy lies in combining purgative and tonifying effects to enhance the nourishing action of the medications while simultaneously utilizing the purgative effect. This approach effectively eliminates excess heat while preventing weakness. For patients with a weakened constitution suffering from warm diseases, especially those who have inadvertently depleted their body fluids due to prior treatments, resulting in symptoms of both deficiency and excess, this specific treatment approach can be used for rescue. In my 20 years of clinical experience, I have found this method to be highly effective in treating patients with warm diseases. I consider it a unique approach, and I am not aware of whether physician Zhu Tong has similar experiences. The ingredients exhibit bitter, salty, and mildly cold characteristics, possessing the functions of clearing heat, detoxifying, and replenishing bodily fluids. The components include 1 liang of yuanshan, 8 qian of maidong, and 8 qian of zishengdi. After boiling these ingredients, take out 3 cups of the resulting liquid, which can be consumed when thirsty. Continue drinking until the medicinal liquid is exhausted. If there is no bowel movement, the preparation can be taken again. This treatment is suitable for patients with warm diseases presenting symptoms of constipation, heat accumulation, and fluid deficiency. If the patient predominantly exhibits excess symptoms caused by an excessive heat pathogen, the purgative method should be used. In cases where there is a condition of both deficiency and excess, with evident fluid insufficiency, purgative medicines should not be mixed, and this treatment method should be employed instead. Yuanshan, with its bitter, salty, and mildly cold properties, has the ability to invigorate fluids, control excessive heat, promote bowel movements, and facilitate renal function, making it particularly suitable for treating fluid deficiency. Maidong can address symptoms of abdominal qi stagnation and gastric qi accumulation while also having tonifying and moisturizing effects. Zishengdi can clear heat, detoxify, resolve blood stasis, have tonifying effects, and also promote circulation. The combination of these 3 medicinal substances helps patients eliminate the root cause and promote fluid circulation, hence the name, augmenting fluid. It is essential to note that medication dosage should be reasonable and not excessive. This treatise outlines 3 methods for treating Yangming lower syndrome. For hot accumulation and dryness with evident excess, the ground purgative method should be used. In cases leaning toward heat accumulation without dryness, indicating the presence of side branches, the stomach-regulating purgative method should be employed. If the patient leans more towards fluid insufficiency with relatively mild heat accumulation, the augmentation method is recommended. Physician Wu Yu advocated relying solely on the purgation method for treating diseases, which, if used correctly, can be effective. However, improper use may lead to 3 disadvantages. Firstly, if pathogenic factors exist in both the pericardium and Yangming, and the pericardium meridian is not first cleared but only the Yangming is targeted, patients may still experience consciousness impairment even after clearing the lower meridian, rendering this treatment ineffective. Secondly, for individuals with weak constitutions and insufficient bodily fluids, the use of purgation may lead to night sweats, physical exhaustion following sweating, or even no sweating but increased physical depletion, all of which can worsen the condition. Thirdly, although night sweats may occur after using the purgation method, due to the damage to yin energy, it may result in upper respiratory symptoms, diarrhea, night heat sensations, and morning coldness and weakness. For these reasons, the treatment of Yangming diseases cannot solely rely on the purgation method and must pay simultaneous attention to reinforcing Yang and nourishing Yin to avoid potential consequences that could lead to death months or years later. When physician Wu Yuk established his treatment method for warm diseases during a contemporary epidemic, as the approach had not been thoroughly examined, it should not be easily applied to the present day. This treatise presents circumstances where it can and cannot be used and when reinforcement can or cannot be applied, awaiting the judgment of wise physicians. Additionally, the sweet warming and spicy warming method proposed by physician Zhong has some utility in damp warmth cases but should be combined with bitter, purgative, and dilution methods, as promoting drainage is more important than conservatism in treating external pathogens. However, for wind warmth, warm heat, warm epidemic diseases, and warm toxins, this method should absolutely not be employed. 12. For cases of Yangming warm diseases, if there is excessive sweating after treatment, it is necessary to replenish the patient's yin fluids. In such situations, Yi Wei Tang can be used for treatment. Warm diseases themselves are conditions that harm yin fluids, and after administering medicine, pathogenic factors are expelled, leading to sweating. The sweat itself contains components of yin fluids, so it's essential to emphasize the need to replenish yin fluids. In this context, yin refers to the gastric yin fluids because all 12 meridians are nourished by the qi of the stomach. If the yin fluids of the stomach can be restored, the yin fluids of other meridians can also recover. To restore yin fluids, a sweet and cool method is required. The name, Yi Wei Tang, includes Yi Wei, which means replenishing the stomach. This is because it assists in restoring yin fluids by nourishing the yang qi of the stomach. In situations where there is an urgent need to replenish yin fluids after medication, it is essential to avoid future weakened symptoms caused by fluid loss, dryness, dry cough, and internal heat sensations. The ingredients of Yi Wei Tang are sweet and cool, including 3 qian of shoshan, glenia root, 5 qian of maidong, ophiopagan root, 1 qian of bingtang, rock sugar, 5 qian of 11 shen di, rihania root, and 1 qian and 5 fen of fried yushu, Solomon's seal rhizome. After boiling these ingredients, take out 2 cups, to be consumed in 2 doses, and the remaining residue can be boiled again for 1 more cup to be taken later. This treatment method aims to replenish yin fluids after sweating due to Yangming warm diseases, ensuring the prevention of further complications related to fluid loss and dryness. 13. In cases where there is no sweating after administering medication and the pulse is floating, the use of Yin Qiao Tang, honeysuckle and forsythia decoction, is recommended for treatment. If the pulse is floating and strong, Bai Hu Tang, white tiger decoction, is advised. If the pulse is large and rapid, indicating the presence of blood stagnation, Bai Hu Jiao Renchen San, white tiger decoction with ginseng, can be employed. These situations occur when pathogenic factors return to the surface after administration of medication. In warm diseases, pathogenic factors initially descend from the upper part of the body to the lower part, and then they ascend from the lower part back to the upper part. Therefore, after medication, the qi flows smoothly, and the body attempts to expel sweat but fails to do so. By examining the floating pulse, it can be determined that even though pathogenic factors are inside, they still have an effect on the surface. Consequently, in treatment, one should adapt to this characteristic by reinforcing the diaphoretic effect with Yin Qiao Tang, simultaneously using honeysuckle and forsythia for detoxification to gently disperse the exterior pathogenic factors. This is achieved by a combination of pungent spicy and cool cold, as well as sweet and cool medicinal herbs. If the pulse is floating and strong, indicating intense heat and rapid depletion of bodily fluids, then Bai Hu Tang should be employed. If the pulse is floating, strong, and blood stagnation is present, signifying that the body's essential qi cannot support it, Bai Hu Jiao Renchen San is needed. Therefore, Bai Hu Tang and Bai Hu Jiao Renchen San are used for cases involving intense heat and insufficient bodily fluids. The ingredients of Yin Qiao Tang include 5 qian of honeysuckle, 3 qian of forsythia, 2 qian of bamboo leaves, 1 qian of raw licorice, 4 qian of ophiopagan, and 4 qian of rihania. This constitutes a combination of pungent spicy and cool cold, as well as sweet and cool medicinal herbs. To be continued.